Oh, I'm so excited to talk about sex, right? Like who does
I'm
not
always
talk
excited.
about sex?
I feel like a lot of people they don't love talking about it about themselves. They maybe like talking about it in general, but when
Yes,
they start talking about themselves, they get a bit uncomfortable.
of
So
course. We're not used to it. We're not really, for most of us, didn't grow up in homes where that was like an open topic of discussion. Like you have the sex talk, and then
yeah.
that's kind of it. So,
For most people, yeah. And sometimes you don't even get that. You don't get the sex talk. And even when nothing is said, that says something. Even if we think like, oh nothing bad was ever said, and you ask someone like, okay, what was said? Well, nothing. That says something.
yeah, yeah. There's sex is probably one of those topics where there's so much shame associated with it, so much misunderstanding, confusion, right?
Yeah.
Like I hear all the time, like, is this normal? Is this normal what we're going through? And I'm like, yes,
Yes.
it's all normal. Like, for the
Yeah.
most part, it's all normal.
It's all normal. Yeah. Is
Yeah.
it normal? I think I was like, almost like if I could just start us off with saying one thing, like if the question is it normal? Chances are the answer is yes. Yes, it is. And I feel pretty comfortable saying that without even knowing what the issue is, because most of the things that we experience around sexuality, if we're questioning it, it's because we just don't have the information or the resources. So that's why we question if it's normal. And also the way sex is portrayed in media, it's portrayed in just the sexual scripts that exist in our society aren't the only ways to be. They're also usually altered to fit a certain box, right? And so that doesn't mean things that are outside of that really tiny box aren't real, aren't true.
Exactly. Oh, I love that. I love that. It just like puts people at ease. Like for me, hearing that, I'm like, yeah, puts me at ease. Like, yes, whatever you're struggling with around sex and sexuality, it's okay. Right. And there's people that can help, like Diana. Let's talk about some of the issues that people tend to come to your clinic with. Like, what are some of the presenting concerns that you see?
Yeah. I mean, I'll say that we probably see like just about anything in that around sexuality, and that's really what we want. We want people to know if they feel like something's going on around sex or sexuality, that they can bring it to us, and really nothing is off limits. But there's definitely, I'd say, trends that we see, and a lot of, if you're struggling with feeling desire to be sexual with yourself or with your partner, and this is regardless of your gender. So just in general, that's a really big one. Also, painful sex is another really common one that comes in. Healing after sexual trauma, but also things like erectile dysfunction, and I like to say like pretty much everything shows up. But a really big one is definitely lack of desire, or low sex drive. I usually don't call it a sex drive. I'm really big on calling it desire.
Okay. So what's the difference there? And what's the distinction?
Yeah, absolutely. So I take it from Dr. Lori Brotto. She studies desire quite a bit, and she often talks about how when we call something a sex drive, we think of it purely as a biological mechanism in our body. And in reality, if we really look at a sex drive, it's not technically a drive in the sense that we don't die from not having sex. We might think we will because we feel really lonely or we feel disconnected, but the actual root of it, we won't die from not having sex. Not like drinking water or sleep. Those are actual drives that if those don't happen, we can die from them. And so I find that one of the things is kind of just taking that away, that it isn't a drive, but also when we call it desire, it's something that we can actually affect a little bit more. We can affect change in, versus drive. It's like, well, I have a sleep drive and I just sleep according to what my body tells me. But instead, when we think of desire, we can think of it as an emotion. We can think of it as something that we can either add certain things into or take certain things away to experience more or less of it. So if it's one of those things that just gives us control.
Right. Oh, I love that. I love the sense of empowerment, because with any change, you need that sense of personal empowerment. I'm curious about in a couple, like when a couple comes in and we're saying it's about desire. I wonder how that makes the other person feel. Because I'm just imagining like, well, if my partner had low desire, is that low desire for me, or is that something that they would have to work on? Do you know what I mean?
Yes. Yeah. There's almost two ways I like to characterize desire. I think of it either as, low desire, or is there desire discrepancy? Because there can be a bit of both. And I mean, with low desire, you'll often have a desire discrepancy, but sometimes there isn't a low desire on one person's end. It's just that the two people have a different desire for how much sex they want to have. It's not about, low or high. It's just, there's a difference.
So it's not desire for the act of sex.
Yes, exactly. Yeah. And yet, and absolutely, we have to take in the relational piece, because that, of course, can play a factor in it. When we're just looking at the areas of desire, relational is one of the things we'd want to look at. What is the relationship like? Is there safety? Is there trust? Is there closeness? That foundationally has to be there. And that can't be the only thing. There has to be more, right? There has to be a sense of fun, playfulness. There also has to be a bit of attraction. Attraction, that I like to say that we overemphasize attraction, to be fully honest, that there's a lot of other reasons that we can and do have sex beyond attraction, especially in longer term relationships. Attraction sometimes isn't the main thing. And that's not, I think we have a big thing in our society about attractiveness. Like we want our partners to be really attractive and for others to find them attractive. And yet, attractiveness is something that changes over our life. And that can't be the only thing that draws us to our partner. We have to have other motivators, and motivators is also a really big thing we would talk about when it comes to desire.
Okay, so can we talk about those motivators? Because I'm just imagining, like, for any of the viewers out there who are thinking like, okay, yeah, I'm in a longer term relationship. Mm-hmm. Maybe I'm not as attracted to my partner anymore.
Yeah.
What other motivators can they work with?
Yeah. Well, this is where it's what's beautiful about this is it's so individual. So, it's really about helping you start to think of and explore the reasons of why you would want to either initiate or respond to an initiation for sex with your partner. So those can be a sense of closeness. Those can be for, just feeling like having fun, being playful. It can be to laugh. A lot of people actually really enjoy sex for like a fun aspect of it. Mm-hmm. It can also be for pleasure. That actually can be a really great motivator, is to experience pleasure. That can mean orgasm. That can also not mean orgasm. I think of pleasure a little bit more open than just orgasms. Mm-hmm. But we want to look at what are the reasons. And the biggest thing I would tell anyone is your only reason can't be your partner or for your partner's benefit. At least one, if not more, of the motivators has to be for you, and it has to be for your benefit, because that pleasing your partner is not a motivator. It's actually a huge break.
It's an obligation then, right? I can see how that would, over time, not be an incentive.
Nope, absolutely not.
And I'm guessing that for some couples, resentment or trust betrayal, things like that can really put the brakes on their sex life, right? Because when you're talking about safety and security, if we've had, and it doesn't have to be a trust betrayal as in like cheating. It doesn't have to be. It can be this person hasn't been there for me in the way that I need them to. And that might be because we haven't been asking for it in the way that they can hear. It might be because they don't have the resources available. It might be for a number of reasons. But if you have a situation where there's like that type of thing, where the safety and security isn't there, how do you kind of help couples reestablish that so that they can then enjoy their sex life again? Yeah,
that's the number one thing. I'd say that's the first thing that I'm actually assessing for in a couple is, what is there a level of safety and connection and closeness? And if there isn't, we're actually maybe going to even put the focus of sex to the side for a moment, because we just want to help you reconnect and get to know one another. So we're going to focus on, actually starting to date one another again and getting to know each other, and also repairing some of those areas that maybe have led to that resentment or lack of trust. And so that really becomes the focus of being able to have open communication, being able to tolerate uncomfortable conversations together, and learn tools and skills around sitting down and having those conversations, teaching you how to have a bit more fun. So planning dates for one another, initiating non-sexual types of touch is a really big one as well, because often when there is, let's say, resentment or a lack of trust, and maybe the sex is going away, or there is just an absence of a sex life, all touch feels pressured. All touch starts to feel like it's meant to lead to sex. And so we actually want to take that away.
That's huge. That's really huge. And partnerships where one partner maybe doesn't have as high of a desire as the other partner to engage in sex, and then feeling that pressure. Like I've had people in my practice come in and say, individually, and say, yeah, my partner, like every time I touch them, they just like freeze up. Like they don't even want to cuddle anymore. They don't want to give me a kiss goodbye. Like I'm going to the bedroom. I'm not going to ask you to have sex with me right now, but that's what it's interpreted as, right? That's huge.
Yeah, that's a really big one. Usually the first thing we try to break is the pressure expectation cycle that comes with touch.
Right. And so that kind of leads into this desire discrepancy, which I'm assuming is when one partner has a different level of desire than the other to engage in sex.
Yeah, well, there's just a difference between the two. Okay.
And so that's something that you work with quite a bit.
Yes.
Yeah. So for partnerships where one partner has a lower desire than the other, how do you kind of approach that? Because I'm assuming that's a common problem. We're all so different. We tend to be with people that are not exactly like us, right? So there's always going to be some kind of a discrepancy.
Yes.
So at what point would people kind of start to come into therapy?
I mean, I will say that I usually see people I usually work with people whose desire discrepancy is usually pretty big. It's not just like I want sex once a week and I want sex 4 times a week. And so I usually work with people who have had trauma or have, really are experiencing low desire, or one person actually experiencing, sexual compulsivity and are actually experiencing really high desire. So usually I work with people who have a really big gap. Because those are the ones that usually they can't navigate the discrepancy, because like you said, we all experience a discrepancy. That's really normal. It's really unlikely that we find someone who matches us exactly, and also who matches us exactly for 20, 30, 40 years. Like, I think that's the other thing is, sometimes we'll match at the start because it's exciting, it's new, it's, sex is about really getting to know one another and being vulnerable. And as time goes on, the need to do that goes away because you have the security that takes its place. And so that's when you'll notice the discrepancy become more and more. Most couples can navigate it. They understand that things will change over time. And that's often the message I have to give to people, is that it's normal for things to go, to have higher desire at times, lower desire. And that usually when we get stuck, it's because we panic that we're stuck, that we feel low desire. So when it comes to desire discrepancy, I think it's really first just looking at what are they considering a desire discrepancy? And sometimes it's helping people manage their expectations. And that can be a really hard one. There's sometimes grieving that has to happen of, we used to have sex every day and now we maybe have sex once every couple of weeks. And even if, we were to really help you to feel closer together, that discrepancy might actually not change a ton. And sometimes that's actually the work that I'm doing. It's not necessarily to match people up on the same desire level. It's to actually help them navigate their differences and be okay with it. That's actually the work. The work isn't to make it the same.
Okay. And I'm assuming that part of that is to help the partner that has the higher desire to recognize that it's not because of them. Like, because I think that might come up quite a bit, especially in let's say heterosexual relationships where it's the male partner that has the low desire, because we have this kind of stereotype that men are supposed to want sex all the time. And if they don't, then the message is, well, maybe it's you, female partner, like maybe not good enough, right? You're not attractive enough. You're not doing enough, right? And so the female partner can really take that to heart. That's a lot in the couples that I see, like self-confidence, self-esteem just plummet, right?
Exactly.
Because we so take that on.
Yeah. Yeah, that's why I really try to break that connection between attraction and desire. That, it's, yes, it can be a part of it, but they really don't actually go hand in hand that much. And so, yeah, I think with couples where really, especially for a heterosexual couple where the man is experiencing lower desire, that we also want to talk about how hard it is for them to be experiencing that low desire, and looking at what's going on, what's happening, what also, again, what means low desire for them. Is it that they just don't feel any desire, or is it that there's a difference from when they first started? And it is helping that lower desire partner be able to share with the higher desire partner what's going on for them, what they're feeling, and just helping that higher desire partner be able to hold space, and also reverse it as well, be able to have the low desire partner hear the higher desire partner, and not take that as pressure expectation, but rather just hold whatever feelings are coming up for them. And usually once we can start to do that, naturally we start to feel closer, and we do see that people are willing and able to come together a little bit more with the right tools to realize, okay, what do I need in order to begin to have a sexual experience? And yeah.
So it kind of sounds like maybe not for cases with sexual trauma, but for those couples that don't have previous sexual trauma, that sex can actually sort of be a symptom of the relationship. So when you start to build up the relationship, you start to build up the security and the trust and the closeness, and getting to know each other again, and respecting each other, and really feeling loved, that your sex life can kind of improve whatever standard you have, and just because of that. Is that right?
Yeah, I'd say it can. I always like to give the caveat of it also cannot. And I think that's a really common, kind of common misconception, that if we repair the relationship at an emotional level, the sex will follow. And that's where we need the emotional relationship and the romantic relationship to be stable. So if that isn't there, we have to do that work. Right. But we then have to look at sex almost as a separate thing as well, that we actually have to address it as a different relationship than their romantic relationship.
Right. So talk to me a little bit about that. So when you're addressing sex as a different relationship, what types of things are you looking for? You're looking for the motivation, you're looking for, you're kind of managing expectations, and you're making it known that like attractiveness or attraction doesn't necessarily, it's not the full picture. Maybe it plays a part. So what are some of the other things that you might look at?
Yeah. The biggest thing we're going to look at is looking at context. So people's environments, we see that actually has the biggest impact on their desire to have sex. So context can mean those can mean first just like the very immediate environment. So like when you're having sex, we want to look at, is the sex you're having worth having? That's a question that comes from Peggy Kleinplatz. And it's one of my favorite questions to ask a couple is like, what type of sex are you having? Because if the kind of sex you're having isn't pleasurable, it feels one-sided, it feels, really focused on one person's needs, it's not really going to give you a desire to have it. So we look at the immediate, type of sex you're having. What does your immediate life look like? Are there kids around? Are there, what does your bedroom feel like? Do you feel comfortable in your bedroom? Do you feel like you need more adventure than just having sex in your bedroom? So we want to look at again, immediate context. Also, when are you trying to have sex? Are you trying to have sex really late at night? And sometimes it's really just logistically being realistic. Most people are too tired to have sex at night. And I don't know why we have this idea that we should be having sex at night and that's the only appropriate time to have it, when really that's when most of us are exhausted. Most of us want to go to bed at this point. And again, at the start of the relationship, the novelty fuels that excitement so much that we don't care that it's late at night. We don't care if we're tired the next day. We're willing to put all that aside because we want to have sex with our partner who's new. That goes away as time goes on. That's actually not a bad thing. That's a really good thing, because we can't survive in a relationship that requires all of our attention all the time. So it's actually really good that we adjust that as the relationship progresses. But then it's about creating, space for sex when you do feel like you have the energy, if that's one of the issues. So context can also be, are there things that are basically turning you off? Are there things that are distracting you? So is there a lot of stress in your extended family? Is there stress in your work? Is there just, again, if you have kids, that can be a really big one. Where is there space to be a sexual partner when you have to give to the kids all day? So this is why, it's important that we look at the relationship, but sex has its own, we want to look at all the other things in your life that could be hitting the brakes.
I love that so much because just that line of like, why do we think we have to have sex at night? Everyone's exhausted at night. Like, you've had a long day. And that was like, yeah, why? Why do we feel like
honestly, yeah. I feel like it's a script, like part of our scripts. Like sex happens at night with the lights like slightly dimmed in the bedroom. Like there's quite a lot of expectations around it. And so, sometimes I say, like, let's just throw that out. Let's just start thinking about, when do you have the most energy, right? If energy is one of the factors that gets in the way. I mean, a lot of people get really anxious when they think about trying to have sex when they're tired, because their body's literally telling them, I don't have the ability to show up and be present right now.
Yeah, for sure. So looking at your environment, that's huge. And I think that's,
yes.
I mean, it's new for me. So I'm guessing it's going to be new for a lot of our viewers out there. Like just that, like just making a few simple tweaks to the time of day, to how, your stress, right? Stress is a huge one. And I feel like stress kind of infects every aspect of your life. So of course, if you're feeling stressed out, it's going to affect your sex life, right?
Yep.
Yeah. And then you mentioned hitting the brakes. And I know I heard of that from the book Come As You Are, which I think is a fantastic read about female sexuality. And I think every person should read it, but
agreed.
Yes. So can you explain a little bit about hitting the brakes?
Yeah, absolutely. So Come As You Are, I agree. I like to kind of shout out that book whenever I can. Yeah. Pretty much a lot of things that I teach and work with people on is from Come As You Are, because this idea around, we actually, our system has two aspects to it. It has, science, in terms of like science, it has an excitatory system and an inhibitory system, but really has a gas pedal and a brake. And we want to always kind of we have to find what our system naturally looks like. So everyone's system is slightly different. And then after that, we want to look at how do we work with, the things that are, maybe we need to activate the gas, and what is hitting our brakes. And the biggest mistake that people make is they try to add more things onto the gas, because they're like, okay, if I wear sexy lingerie, if I do this, if I do more, I'm going to feel more desire. And I use the car analogy all the time, where it doesn't matter how hard you press on that gas, if the brakes are on, your car will make a sound, it will go nowhere. Right? So we actually need to look at the brakes. That's what we are actually looking at. So brakes are basically anything that turn you off. And it doesn't have to be even in the moment. It can be in life in general. So, illness. Sometimes I'll say even pets can be a break. If you know that your pets are in the bedroom and they're distracting you or they're watching you, that can be a big turn off. Exactly. And for some people, that's not a break. For some people, they're like, yeah, my pet is there, whatever. Yeah. And so we want to go through just different aspects of what could be hitting our brakes. We want to just look at our life and take inventory and see, are there things that we can actually work to lift off? And some things we naturally cannot change. It's more about, how do we find space, or what do we need in order to be able to put that aside for an hour, for half an hour, for half an hour every 2 weeks, right? We want to find ways that we can lift those off. And so taking inventory of your breaks is more helpful than trying to add any spicy new thing that could make it better.
Right. Oh, that is so incredibly helpful. And so I'm wondering about, something that I hear once in a while is that for females, like after giving birth, even 4 or 5 years down the line, body image, right? And it doesn't even have to be after birth. It can be at any point in life, and it doesn't have to be just females. It can be any gender, but like just feeling not comfortable in your own skin, feeling not feeling sexy yourself, right? Not viewing yourself as sexy. And so that can be a huge thing in relationships. How do you kind of,
big.
Yeah. How do you kind of start to work with that aspect?
Yeah. And I mean, definitely this depends if we're working individually or as a couple, but I think regardless, it's helping someone get to know their bodies and feel pleasure in their body as is. And again, we're actually trying to help a little bit that we don't have to make you love your body, right? Like if that's your goal, awesome, we can work with that. But sometimes it's not about loving your body. It's about being able to just be present in your body as is and just being able to appreciate it and be present with it. So sometimes it's just building up again, getting to know your body the way it is now versus maybe how it was before, if there is a change, or if it's just, I just don't feel comfortable in my body right now. It's actually just working on getting you to build your own comfort on your own first and foremost, because if you're not comfortable on your own, it's unlikely that you're going to be comfortable with a partner.
So for any of our viewers out there that are thinking, okay, great, like I'd love to build up some comfort in my body. I'd love to, you know, start to appreciate my body. What do you have any kind of like simple tools that people can use right now, like without needing to go see a therapist?
Yeah. Some of my favorite ones are, you know, just like simple, like self-touch. And that self-touch is not masturbation. I really want to clarify a difference between masturbation and self-touch. That self-touch is about, you know, touching your skin, touching different parts of your body and just noticing and being present with sensations, finding sensations that feel pleasurable to you. When we experience pleasure, our bodies, it's really hard to focus on the negative and for our body to experience negative when there's pleasure coming in as well. So if we can find things that feel good on our body and just really lean into that and enjoy that, we start to build a different relationship with our body. Also, there's that compassion piece that, you know, we need to build that up. That takes time. There's going to be days where you don't feel that, and that's okay. That self-love and falling in love with your own body and even just liking your body is not an overnight thing, and it's not 100% thing. It doesn't mean, you know, you'll try these tools, you'll try to, you know, even find clothes that make you feel really good, and you like look at yourself in the mirror and just see what they look like. And I find that not adding positive things all the time is actually really helpful. To just learn how to neutrally be with your body, I think is actually more powerful and empowering than trying to fake, like say things that you don't really believe. So positive affirmations I think are good, but I think just getting to neutral is more powerful than anything.
And I think that's so important, not just about sex, but about every aspect of life. Like when people try to use positivity and then they're like, why isn't it working? Why isn't it working? Yeah. I think that distinction of let's get to neutral first.
Yes.
Before we even try anything else. Like let's just say like a neutral. So that's where kind of acceptance I find comes in, like acceptance, neutral. Yeah. It's okay. Like it's just okay to be where I'm at right now. That's not overly positive. It's not like, yay, I love where I'm at. It's like,
yeah,
okay. It's okay.
Yes. I love neutral. I like to say neutral is the space I dance in all the time with couples, with individuals, even with desire. Like if you're having a bad experience in your sex life, my goal is not to get you to positive first. My goal is to get you to neutral, because getting from neutral to positive is a lot easier than getting from negative to positive.
Totally. So there's another thing that's been on my mind. There's a few male clients that I have that I see individually who are just kind of starting big relationships. Like they're becoming committed. And I've had this a few times in the recent past where they're thinking, I'm scared because I like the newness of when I was single and having sex with different people. And I'm worried that, you know, I'm getting into this commitment. And you talked about it a little bit earlier, where it's like that newness wears off. In the new, we kind of just like, we want to have sex all the time for a lot of people, for many people. And when that wears off, it can be really scary, right? And so do you have like, do you have any kind of like words of wisdom or advice for these people who are really struggling? Because it's scary, right? It's scary to think about committing yourself to something where you think, oh, I'm not going to feel this way again. Like, I'm not going to feel this like excitement, this like rush that I get.
Yes. Yeah. I mean, I think I don't know if I have, I don't know if it's advice or words of wisdom, but almost, the first thing that I really want to say that, I think it's okay to be, I think it's okay to be sad about that. I think it's okay to miss that. And I think it's okay to actually have a moment where you just, again, need to grieve that, I'm not going to have this particular type of rush or excitement. And that doesn't mean I don't love my partner, doesn't mean I don't want to be with them. It means I'm grieving what I'm not going to be experiencing in this exact way. Right. So first, I think it's important to just, not try to rush past it into positive. Just being, neutral is, I think grieving is getting to neutral. And then from there, I think we have to keep finding the excitement with our partners, keep finding what makes us feel excited. And again, there's going to be times where it's just not going to be exciting. And I think that's okay. We actually really want to normalize that the most of the sex that we're going to have in our life is going to be good enough. It's actually going to be pretty average. And only about like 30% of sexual experiences are amazing. So even just setting our own expectations of it's not always going to be exciting. And I mean, it is if I'm always in a new relationship, but then I'm not going to get the other benefits, the closeness, the emotional, the depth, the vulnerability, the building a life with someone, if that's what I want. And from there, it's finding excitement with that individual person, because if you kind of are like, okay, this is the one person and I already know them, then it's not exciting anymore. It's not going to be exciting. So
it's a mindset thing as well.
Oh, it's such a mindset thing. And that doesn't mean, you have to try all the kinky things to make it more exciting. It's about how would you approach this sexual experience if it was a different person, let's say. If this wasn't someone you've known for 5-10 years, how would you show up differently? You probably would. And so how can you bring that to your sexual experiences?
Yeah, I sometimes say, like, don't bring the you that goes grocery shopping together. Bring the you that like goes on a fancy date night or something, or does something exciting, goes go-karting or something, like different yous.
Yeah, exactly. We don't want that, we don't want the partner who sits on the couch in the sweatpants to also, rip their clothes off.
Yeah.
Exactly.
So, and that's also kind of about how you're showing up, right? Which I think is so important. Like, a lot of I've seen that it's easy to make it about your partner, like my partner's not doing enough, or because they do this and that, then I don't want to have sex with them anymore. But it's also about you, like who are you bringing to the table? How are you showing up, right? How are you loving yourself? Are you taking that time to even just get to neutral with yourself? And like, what are you kind of doing? Because you can't change your partner. You can only look at you.
Exactly. Yeah.
So there's another kind of juicy, like I think a lot of people wonder about this, is pornography. And this is huge, right? Like, in terms of my partner watches porn, what do I do? Or I watch porn and I don't really want to anymore. It's because it can be a very addictive behavior as well, right? So when there's pornography use from one partner that becomes problematic, how do you kind of start to work with that?
Yeah. I mean, this is definitely a hot topic. It's a very debated area around porn. And I will say that I'm a very sex positive person, so I don't take a stance of porn as bad. I think it's more, again, how is it impacting your relationship, and kind of like, what is the purpose of what you're using it for? I think those are the first just questions we're going to want to ask ourselves of, why are you reaching to porn? Is it entertainment? Because that's okay. It's okay for it to be about entertainment. It's okay for it to be about fantasy or excitement that you're not going to get with your partner. But if it now is, it's what you're choosing over your partner every time because it's more exciting, because it's easier, because it fulfills something in you that your partner isn't or can't, that's when we're going to want to probably start to look at, what is it filling for you? Because it's really filling something. And that's why I definitely like to take the lens of pornography rather as an addiction. Rather, it's more of a compulsive behavior that, there's an underlying need that is happening for us. And so we're drawn to it. And so there's either, a coping mechanism there, there's something that it's doing. And so that's what I think we're going to want to look at rather than try to cut cold turkey. Like most often that's not going to help. If we try and cut cold turkey, it's something we're going to probably go back to because again, it's filling a need in us, especially if it's negatively impacting the relationship. Mm-hmm. And it's so detrimental. And that's where it also sometimes is about having a conversation, because sometimes it's detrimental because one partner feels, insecure about it. And then we'd want to look at that, right? Maybe it's not a compulsive behavior. It's not actually happening very frequently, but there's an insecurity that gets brought up for one person. And we want to start to look at that and even maybe help the person who's watching porn explain what they're enjoying within it, why they're using it, and helping that partner understand what's the purpose behind it.
I think that links so well back to what you were talking about in the beginning, because I'm guessing that for a partner whose partner is watching porn and it's making that person feel insecure, there's that kind of direct link of, oh, those people you find more attractive than me, right? And that tends to be like one of the things that then that person can start to feel really upset about, really low self-confidence, low self-worth, like, starting to, all that stuff is taking a dive. So I guess kind of going back to that distinction, can you talk a little bit more about that? Because I think it's such an ingrained part of our society that like attractiveness and sex are so linked. How do you start to tease those apart for people?
Yeah. I think what's just coming up for me as you're asking that, or as I'm just thinking about that, is just a little bit of a piece around fantasy that, we want, we are going to find our partner, attractive in certain ways. That's going to change over the course of our relationship. And, our partner is probably going to, realistically, they're going to find other people attractive over the course of our relationship, because we're human beings. We don't just switch things on and off. We still notice other people. Noticing other people, even finding other people attractive, does not have to mean anything about us. And I come back to fantasy quite a bit when I say that, because people often ask, well, like, how do I know nothing's going to happen? Well, when we look at fantasy, we look at the fact that people have fantasies, and a lot of fantasies that people have, they never actually want to act on them, which shows that we really have a really rich inner world that is just that. It's an inner world. And that our thoughts don't actually indicate a behavior. They don't indicate something we're going to do. They just indicate a thought. They just indicate a feeling. And that's what fantasy is, right? Fantasy is a place where you get to play around. It doesn't mean you want it. It means it's fun to engage with it in your head. And so it's also then kind of recognizing also maybe what are your own fantasies, starting to tease apart. Do you ever look at other people and find them attractive? Do you ever have fantasies that don't involve your partner? Sometimes people don't want to admit it, but just looking at the research shows that most people have fantasies about other people who aren't their partners. Whether or not we want to admit it, that's a different question.
Right. And so then it's like the meaning that we make of it. So if we're making meaning, that means that there's something wrong with you, if your partner has fantasies about someone else, then that can be really devastating to some people. But if it means that it's normal, it's something that a lot of humans do, not necessarily something that means anything about the relationship or means anything about what your partner actually wants to do in real life, then it maybe kind of takes the edge off of it a little bit.
Yes. Yeah.
Okay. So you're not really about, like, it's not really about changing the behaviors. It's more about changing your mindset about the behaviors.
I think both. I think depends is what I'll say. I think mindset first and foremost.
Yeah.
And I think we change the behaviors when there's a real big negative impact on both individuals. And I think that's what it is.
If it's just impacting one individual. So if one partner is watching pornography and the other partner is really affected by it, then talk to me a little bit about that.
Yeah, I think that's where it just gets really, it's so individual. I think this is where sometimes I find it hard to give general advice because
so hard, I know.
Right? Because I think it will just depend on, at the surface level, of course, we don't want to be making completely selfish decisions, but sometimes we are going to make decisions that upset our partners, that disappoint our partners, and that's also okay. Again, we're going to have differences. I think it comes back to how we negotiate that. How do we actually agree on this, and how do we actually work through it? It's not necessarily the presence of it. I think it's how we approach it that matters more than anything.
Kind of brings up that idea of feeling heard, right? Because I think when you feel like your partner at least understands where you're coming from for both sides, that can in and of itself kind of help to calm your physiology around that topic, right?
Yeah.
So feeling heard is so important. So it sounds like facilitating that conversation of just like, so many times, there can be a big thing in a relationship that's really impacting one partner. The other person might not know about it, or B, really understand it, because when that partner talks about it, it's more like a blamey, like, what's wrong with you? Why are you doing this to me? You must not love me. And the other partner just gets their shield up, right? And so they don't actually hear what you're saying.
Exactly.
So being able to have that conversation where it's not a blame game, but it's kind of like, this is impacting me in this way, but I also really want to understand, like, how is it impacting me? Like, what's it doing for you? Talking about that.
Yeah, I think that's, in the end, I say my job isn't to tell you that you need to have more sex or less sex, or my job is to help you figure out how the two of you are going to make that decision, how the two of you are going to figure that out. So even, when it comes to like low desire, my job is to help you, start to feel more connected to yourself, more connected to your partner. And then you two can start to figure out what is right for us, what is right for me individually, and also what is right for us as a partnership. My job isn't to tell you should have sex blank number of times a week.
Right. And that's a big question, right? Like how often do normal couples have sex? Like I hear that.
I hate that question so much. I hate that question. I even hate that there's research about it, to be honest, because I think it makes us feel bad when it's not what we're having. And so I always come back to the question of like, how often do you want to be having sex? What feels right for you? And also, not just even frequency, but sometimes if you're like, no, I really want to be having sex like 5 times a week, I come back to the question of, would you rather have sex 5 times a week and just for the sake of having sex and saying you've had sex 5 times this week? Or do you want to have sex that is fun and connected and feels exciting? And that might only happen once every week or 2 weeks. Right. It's happened once or twice, but most people actually are like, no, actually, I do want the second one. It's not the frequency, it's actually the quality.
Totally. So what about sexless marriages? And I've read research that sexless is defined as 10 times or less per year.
Oh, right? I hate that research.
Okay, so talk to me about that. Tell me what's going on for you with that research.
Yeah, I think first, if we're saying that if we have sex 10 or less times in a year is a sexless relationship, that means like if we're having sex every like 6 weeks, we're technically in a sexless relationship. And I think there's such a stigma around this idea of sexless. And so really, again, if 10 times a year is what is possible for that couple, but those 10 times are wonderful and they feel connected throughout and they're having other types of intimacy and closeness in between, I don't think I'd consider that a sexless marriage whatsoever.
Totally. Yes.
So it puts people into almost like a defensiveness, into there is a problem mindset without even identifying if it's actually a problem for them.
Thank you for saying that, because I felt so like awful when I read that research, and I was like, why did this not sit with me? Like, why? But that's exactly it. That's exactly it. So what about those couples that haven't had sex for years? Because I see many couples like that where it's been like, it's been years, it's been 7 years, it's been such a long time. We haven't had sex, and now it just doesn't even seem possible to get back to that place with each other because it's just been so long. We're just so used to seeing each other in a different way. That can be so like, that can feel so disheartening for
oh yeah, absolutely.
Yeah.
Oh, with those couples, we're wanting to, first I come back to, starting to build up a romantic relationship again. So we want to get them to start dating one another again and start, again, this idea of courting one another. I love this idea that we should never stop dating our partners, right? So we want to get back into that mindset. It's really rare to, if anything, I don't think I've ever seen a couple that has truly continued their romantic relationship and be in a sexless relationship, or one where there's sex without having sex for years. It just doesn't usually go hand in hand. So we want to start having, the romantic aspect, and then we want to start sprinkling in different types of touch. So I never remember this perfectly off the top of my head, but there's kind of 5 types of touch that we want to have in a relationship. And most often what happens in ones where there isn't any sex is there is the first level, which is intimate touch. So that's like holding hands, that's cuddling, that's even kissing can be on that. And then they want to go to number 5, which is sexual touch. And they're missing all of these types of touch in between that aren't goal-oriented, that aren't directed at any sort of, result, that are just about, making you feel good, making your partner feel good, and just having fun together. And so we actually,
or something like that.
Massage, even like experiencing or like touching one another's bodies without any goal, and touch doesn't have to be massage touch. It can be sensual touch. It can be just like a light graze. It can be just seeing each other's bodies again in a different light. Again, it's not my friend or like my best friend's body. It's also not, I'm trying to have sex with you right now. It's just seeing you in a different light, feeling you sensually close to me, and just building that connection there. Usually that will bridge the gap. If we can implement that type of touch, it'll bridge the gap to sexual touch. So that's where I start with a lot of couples.
Okay. Because I'm guessing that in some of those relationships where it's been years and years, it's also hard to view yourself as a sexual being, right? Because it's just been so long. Yes. And so maybe going back to some of your earlier words where you talked about getting to neutral, touching your body again, like just self-touch, starting to see yourself as someone who can accept pleasure, right? Accept pleasure in different ways.
Exactly.
And then also kind of help doing that for your partner as well, right? So that's where that kind of relational aspect comes in. Yeah.
Yes, exactly. That's exactly it. Is start to explore your own body. Start to figure out, if you haven't had any. For some people, they have actually continued masturbating throughout of it. For some people, they haven't. You can also start to explore that on your own, is figuring out what feels good for you, starting to just help your body come alive again, because it's going to need some time as well.
And what about that? Like when you talk about masturbation, what about for many people, there's kind of this, it can be like societal, religious, there can be different shame messages around masturbation, right?
Yes.
Lots of shame for a lot of people, right? Filled with shame. So how can someone who's feeling that shame around masturbation start to view it? Is there a way to kind of like start to change your mindset around what masturbation is, the purpose that it serves? Is it, like what it can do for even physical health, like just for people in general, for self-confidence, things like that?
Yeah. I mean, just from, I sometimes find it helpful to just even look at all the research that shows how healthy masturbation is for our bodies, just seeing that it like significantly reduces cortisol. So we actually have also better sleep when people regularly masturbate. There's, improvements in cardiovascular health. There's just so many benefits that we see from it. But overall, if shame is present, touching our bodies is actually a really great place to start. Maybe not actually starting with genital touch. Starting, I think of masturbation can be anything that creates pleasure in our own bodies. And so if we can just start to find pleasure in other parts of our bodies and just really experience that and be present with shame as it's there, we can then work our way towards more focused genital touch to masturbate. And then the shame, we've built the shame's confidence that everything will be okay, basically. Sometimes I like to externalize shame in that way, just noticing shame as a part of you that's there. And it's there for many reasons. It's maybe scared about what's going to come up, but if you can just notice it, just have it be present with you and explore your body in other ways and work your way towards genital touch, that there's other ways that you can feel a lot of pleasure in your body besides touching your genitals.
Okay. When you were talking about relationships that the partners haven't had sex in years, for some of the couples that I see, chronic pain is a part of that. And so, they might actually be dating each other. They might actually have that kind of romantic and the other types of touch, but sex itself is either painful or they have pain in their body that prohibits it. And I guess related to that is just painful sex, right? Because that's one of the things that you said is quite common as well. So can you talk a little bit about those two situations?
Yeah, you're going to hear a theme throughout everything I talk about, which is, I come back to pleasure all the time because, I think that's what, especially with pain, that pleasure, we actually, there's research that shows that pleasure is really effective towards pain. And so if we can help our bodies experience more pleasure, it actually helps lower our interpretation, our experience of pain in our bodies. And so we want to then focus on, if it's more chronic pain, maybe it's not sexual pain, but it's chronic and more in other parts of our bodies. Finding the type of sexual activities and experiences that we can have that, maybe aren't as aggravating to the pain, or, just also focusing on the pleasurable aspects of it. And that sometimes the pain will be there and we need to focus on the pleasure because that's what's going to help our bodies kind of release and relax into the experience. So, I just always come back to, regardless of the type of pain you're experiencing, find what feels pleasurable, find what feels good. And that's what you want to, that's ultimately, if you're experiencing that, if your partner is experiencing that, and you're experiencing that together, you're having sex. That's kind of like what I like to say is, I think we need to expand our definitions of sex. That's a really big part of also when we experience sexual pain is chances are, you're going to want to be working on enjoying and experiencing other types of sex while you're figuring out what is happening in terms of the sexual pain, because sex shouldn't be painful. So if it is, we want to be looking into that. And I'm a really big advocate of pelvic floor physiotherapy. So if you are experiencing sexual pain, definitely think that, look into pelvic floor physio. It will be really helpful for that. It's going to help you identify what's going on. And in the meanwhile, enjoy other types of sex, right? There's no, I wish all sex was on the same level for everyone rather than intercourse is up here and, oral sex is here and, manual sex is lower, because we even think about the word foreplay. Foreplay is a means to get to intercourse. And so, what if, foreplay was also sex, which it is.
I love that. Because that kind of, that like really takes it takes all the pressure off, right? It's like, I don't have to do this set defined thing in order to say that we have sex, like, once a month or whatever. Like we can do different things. We can engage in foreplay and still have a sexual relationship. Any type of pleasure that we're giving each other can be kind of classified as sex.
Yeah.
So we're having a lot more sex than we thought we were.
If everyone could reframe that in that way, it would be amazing to see, what would happen if we just started characterizing everything that we did that was about pleasure with our partners and created really good feelings in our bodies, how much more sex we would actually realize we're having.
That's amazing. I love that. Thank you so much, Diana. This was awesome. We kind of covered a lot of different topics, and I'm going to have to be back on the show like multiple times so we can really dig deep into some of these.
Absolutely. I could talk about all these areas a lot, especially, you could put me on a soapbox around intercourse and, leveling it out in terms of everything else. I could talk about that forever.
Perfect. Next time we'll do that.
Yes, I love that.